Let's continue to study depression with case history number 8 and 9. Our first case is a 37-year-old woman who had been suffering from depression for 2 years after the birth of her fourth child. She had 4 children close together. She felt depressed and lacked any drive. She felt confused about her life aims and was torn between the desire to go back to work or to spend all the time at home to look after her children. She felt exhausted all the time with a desire to lie down. Her periods were regular and not painful, but she suffered from premenstrual tension manifesting with a pronounced irritability and an aggravation of her depression. Her tongue was slightly red on the sides but pale in general. Her pulse was weak and choppy. Diagnosis. Again, the tongue and pulse are crucial to the diagnosis. The choppy quality of the pulse and the pale color of the tongue indicate blood deficiency. The redness on the sides of the tongue indicates liver cheese stagnation. There is also a spleen deficiency as evidenced by the tiredness and desire to lie down. Our next case is a 48-year-old woman who had been suffering from depression for over 10 years. Her life had been very difficult in this time, going through the loss of a child and a divorce. She felt depressed, extremely tired and sad, and was prone to crying. She was pale and spoke with a weak voice. She also suffered from backache, and on interrogation, it transpired that she felt easily hot and experienced a dry mouth at night. She had a feeling of constriction of the chest. Her tongue was pale but had a red tip. The coating was rootless. The pulse was weak on the right hand position and generally empty at the deep level. The diagnosis. There are symptoms of lung qi deficiency as manifested by the pale face, weak voice, tendency to crying, and weak pulse on the right front position. The feeling of constriction of the chest indicates some stagnation of lung qi. In emotional problems, this frequently accompanies a lung qi deficiency. Other symptoms indicate a kidney yin deficiency, as manifested by lower back ache, dry mouth at night, pulse empty at the deep level, and rootless tongue coating. The sadness and grief deriving from her loss and separation injured lung qi and kidney yin, resulting in depression and a restraint of the coming and going of the ethereal soul. The kidney deficiency involved a deficiency of the willpower or qi, and this caused her to lack drive and enthusiasm. Lung 9, lung 3, bladder 13, bladder 42, to tonify the lungs, soothe the corporeal soul, and lift the mood. You can also use REN 4, spleen 6, kidney 3 to nourish kidney yin. And bladder 23, bladder 52 to strengthen the willpower, and do 20 to lift mood. The combination of acupuncture and herbal medicine produced excellent results in a relatively short time. After 15 months of treatment, the patient felt very much more positive, did not cry, and looked forward to the future. Thank you for your attention.